Coming. Got it. Hi, everyone. Tonight, we're going to talk a little bit about the importance of newborn screening, important timelines that are available for your child over the course of their life, and some tips required for international travel. This project is sponsored by National Family Voices and the Association of University Centers on Disability. We'll begin with a discussion on newborn screening and would like to introduce our friends. Debbie Ellis is an RN. Hi, Debbie.
Hello.
Ginger Nichols, who is a genetic counselor from the Newborn Screening Network.
Hi.
Hi, Ginger.
Hi.
And tonight we're also joined by a parent who will share her experience. Amy Magyar.
Hello.
And of course, we're also joined by my friend and colleague, co-director, Carmina Sirioli.
Hello. Hello. Okay.
So first I'll ask Debbie and Ginger to talk a little bit about what newborn screening is.
Sure. Newborn screening is actually 3 parts. It consists of the newborn screening hearing test, a pulse ox test that checks for critical congenital heart defects, and a newborn screening blood spot card. The Connecticut Newborn Screening Network that Ginger and I represent deals primarily with that newborn screening blood spot card. And newborn screening is the practice of screening every baby prior to hospital discharge, ideally between 24 and 48 hours after birth, for rare conditions that may not be obvious when a baby is born. It allows babies to be diagnosed and to start treatment before they get sick, hopefully preventing any serious health problems. Newborn screening is the largest and most successful public health program in the country, and it is the fastest, safest way to protect a baby against certain conditions.
And so for the blood spot testing part in Connecticut, we test for over, it's hard to really put a number to it, but over 60 conditions. And so some of them might be ones you've heard of before, like cystic fibrosis, which can cause thick mucus to build up in the lungs and infections in the lungs, or things like congenital hypothyroidism, which means the thyroid's not working well, making the thyroid hormone, which is important for lots of our bodies, parts to do work right. And then sickle cell disease, the screening test actually looks for a lot of the sickling disorders, not just sickle cell, but sickle beta thal. And then PKU is probably the most common thing you've heard of for a metabolic condition, but because that was the very first condition that the newborn screen started testing for in 1960s. But since then, like I said, there's many 60. So if you hear anyone call it the PKU test, that's not the right word. It's called the newborn blood spot screen.
Thank you, Ginger and Debbie, for that quick explanation, kind of one-on-one on newborn screening. So Amy, we wanted to ask you to share a little bit about your story and experience with newborn screening, and then Deb and Ginger will ask you some questions about that.
Absolutely. So my son was born in 2008, and when he was born, he was lethargic, losing some weight. He wasn't eating. However, we were told that that could just be typical newborn symptoms. But when he was 7 days old, we were notified that the state of Connecticut newborn screening test had detected a rare genetic condition called a urea cycle disorder. If not for the newborn screening test, my son would have passed away, probably at about probably 8 or 9 days old. And we never would have known what was wrong, and it probably would have been classified as SIDS. But because of newborn screening, the condition was detected early. We were able to manage it accordingly. And although he still lives every day with his condition, because of newborn screening, he is now a thriving 15-year-old boy.
You're on mute, Nancy.
Thank you. Thank you for sharing that story, Amy. And I think one of the reasons why we're doing this is because there's still a lot of questions that we get around newborn screening. Everybody knows that when your baby is born, they take them away and they do tests. But if you ask people what tests are, as Ginger and Deb said, I don't think a lot of people understand. And so it's always important for us to, to keep doing this education so that families are well informed. So I'll turn it back over to you, Deb and Ginger, to ask Amy some follow-up questions.
Sure. Amy, when you think back about the newborn screen being done and you being told about the results and your whole journey to get to the point where Mitchell is now, can you think of some things that went well in the process?
Sure. What went well was definitely how it was handled as soon as we got to the hospital. We went to CCMC and everything was wonderful. We were ushered in immediately, no waiting. They were expecting us. So as soon as we got there, we were ushered into the ER. They had an entire team of doctors that knew exactly what was wrong with Mitchell. They knew what to test him for, which were his blood ammonia levels. They had everything ready. It's a very specific test on how it's drawn. You have to have certain things there to make sure that it's drawn correctly. Not everyone knows how to, well, actually, most people don't know how to draw a blood ammonia test. They had the right people there. They knew how to do it. There was an extremely experienced genetic doctor there who actually had cared for patients with this rare health condition prior. So he was able to sit with us and explain everything to us, and he was patient. And because this is extremely rare, it was not something that we were going to learn a lot of information from other people or be able to have, a phone call with other parents. So we were lucky to have him there. We had dietitians that could help us with our son's diet, genetic counselors. We had an entire team assigned to us that helped us through the process. And those first few days were just critical, because we thought that we had had a healthy baby and our life was completely turned around by, thankfully, by the newborn screening test, but then also dramatically by the newborn screening test.
It's so good to hear that the hospital handled it well when you got there. And we work with specialty providers at both Connecticut Children's and Yale in a variety of specialty areas in genetics, endocrine, hematology, immunology, neurology, and they are excellent physicians who take excellent care of the patients. And they review every newborn screen as it comes in, and they'll make recommendations. Not every baby has to go to the hospital and be worked up for labs there. Sometimes they can do labs outpatient and reviewed, and maybe they don't even have the condition. Newborn screening is, after all, just a screening test. And many babies that flag as out of range are not actually diagnosed, but many are. So that's why it's important to get the follow-up blood work and to follow through with the recommendations that the specialist makes, no matter what the condition. Unfortunately, there can sometimes be a lot of miscommunication early on. Did you find any challenges or any difficulties with that?
Yes, and I have some points that I want to make about what you just said too, so we can go back to that. We actually, for anyone who might be listening or listen later on, about Yale and CCMC, I had the pleasure of working with both. CCMC is our dedicated hospital, but for anyone that is throughout the entire state, we participated, because the condition is so rare, we participated in a study with Yale throughout the Urea Cycle Disorders Foundation. So, and we also had a wonderful experience at Yale with their genetics team also. So, you could also, in the future programs, or later on in this talk, if you have time, you could explain how the state is split in half, and some people go to Connecticut Children's, some go to Yale. And I also do want to make the point that not all newborn screening tests do result in what happened with my son. That's why we went that day. They said it could have been a false positive, but he was already presenting with symptoms. So there are as many times as children present with symptoms, there are just as many times where it is not. It could potentially be nothing. And that is why it's so important that every parent, if anything is flagged in a newborn screening test, that they do, as you said, Debbie, follow up and make sure. Maybe your child is not presenting symptoms at that time. If we had gotten the newborn screening test back at day 2, my son would not have been presenting at that time. He was presenting at day 7. So if we had gotten the test at day 2 and didn't bring him, he would have been extremely sick by day 7. So it's so imperative to parents, whether they see the symptoms or not, if they think it's a false positive or not, go get the follow-up test. It's simple. It's a quick visit. It's an hour out of your time. It can either give you a peace of mind that your baby's completely fine or save your child's life. So that's so important.
I like how you said that. Yeah, it's definitely better to be safe than sorry, right? You just
And either way, obviously I didn't want that answer that there was something wrong with Mitchell, but it ended up that we caught it early and he was given everything that he needed to have to live a fulfilling life. And he's now 15 and doing amazingly well. That would not have happened if it wasn't for newborn screening and catching it quickly and giving him everything that he needed right from the moment of onset. So it's worth the time to take to make sure, is it a false positive or is it really a positive? And you had asked me if I wish that anything had been done differently. And yes, I believe that pediatrician appointments or pediatrician offices really need to know what's going on and understand the urgency of this. Ours waited. They waited until we were scheduled for an appointment. So they waited until our appointment to tell us about the newborn screening results. And I feel that those hours that waited were critical to my son and could have resulted in a different outcome. We were fortunate it did not. So I think just education and I'm sure that a lot has changed over the last 15 years, but education in regards to everyone, the parents. I wasn't really educated on newborn screening before I got the call, or before I walked into the pediatrician's office and was told about newborn screening and how it impacted me right then and there. I think the pediatrician's offices weren't really aware of how to handle those calls back in the day. And so I think that there were a lot of steps that could have been taken in educating parents, educating the pediatrician's office, and when they get the calls, having designated people that take the calls, contact the parents, let them know what's going on, how to handle it. There were a few steps before we walked into CCMC and had this wonderful team to greet us that possibly could have prepared me more for what I was in store for.
Those are all really good points. And fortunately, we've come a long way since then. Unfortunately, a lot of these issues still exist, and we're working really hard to try to improve the system the way that it is. We're trying to educate all stakeholders. We have reached out to OB offices and talked about the importance of families knowing about newborn screening during the pregnancy so that they're prepared and know what to expect when they're in the hospital. We've reached out to the birth hospitals and provided them with materials and education about how to explain newborn screening to new parents when you're actually going to perform that blood spot test. I think many times the baby's taken to the nursery and the blood work is done and they might be told the newborn screen was was done, but a real explanation isn't given. And I think a lot of healthcare providers aren't comfortable discussing newborn screening because they didn't even receive education about it. In medical school and in nursing school, newborn screening is a couple sentences in a book and it's often glossed over. So it's really important for nurses that are working in those specialty areas and doctors that are delivering these results to have some educational materials or to feel comfortable presenting these results and to use proper language. It can be really confusing when healthcare providers use terms like PKU test and the family then researches PKU and learns all about PKU when that child's newborn screen might actually be about a different condition altogether.
Yeah, thanks for sharing that. And Amy, thank you so much for sharing your story and your experience with it. And the other thing that I want to add in terms of educating is that we have Path CT has worked with the Newborn Screening Network team to form a family advisory council where families like Amy, who's on the advisory board, along with a group of other wonderful parents who've also had newborn screening experiences, sits to inform the work that Debbie and Ginger and the Newborn Screening Network are doing, and to help to give them these tips, stories like this, share stories like this, so those gaps that Amy had experienced with her son are filled, and we can give feedback in that way. So it's been a really, really nice experience working with the team and families to get their stories and change really the systems and programs that are available for families and that families can take advantage of now. So it's good to see that 15 years later things are getting better and continue to get better. And it's good that medical professionals are working with families to get their lived experience stories to help to inform their work. All right, so we're going to pivot a little bit and talk about vaccines now. We talked about newborn screening being an important first step for a child, but obviously that we know when your child grows along the way, there are other vaccines that are necessary. So we're sharing this information and resources on vaccines for any family that's interested in understanding the important vaccines that are available for their child. So in the chat or later on our Facebook page, we will be able to share some documents, infographics that we've put together. And I just want to turn it over to Carmina to talk about kind of the process, how we went about building the infographics and where where people can access them.
Okay, so hi, and yeah, thank you. I love listening to the whole newborn screen, and I just wanted to say that. So we, as Nancy said earlier, are working in putting together infographics regarding vaccines. And again, this is more of an education, make people more aware of what is out there, what vaccines are available for your child and so forth. So we put together 10 different infographics, which, like she said, we will be posting on our Facebook page throughout the next few weeks on a bunch of different topics. We've got, starting with what is newborn screening, and then there's one, how to care for your child after their first vaccines. There's
vaccines before pregnancy.
There's vaccines before pregnancy. There's birth to 24 month vaccines, like what month will your child or should receive certain vaccines, common questions people may have regarding vaccines. There's many, so, and again, all this information we were able to get through the CDC. So it wasn't something that we just, gathered it, but so we got it through CDC. Debbie and Ginger have shared some materials with us that we also pulled together. And these will be shared through again, like I said, through our Facebook page over the next few months. And if you need anything, if you want copies of something that we want mailed out or emailed, you can easily just send us an email at info@PathCT, and we'll be able to get that back out to you. But again, we just really wanted to make sure that people are aware of what vaccines are and what is out there for your child. I mean, we go from pre-birth, like Nancy said, from pregnancy all the way up to 18, for college years. Because when you enter college, there are some vaccines that are recommended And then we also, which I thought was great being that the summer's here, is, keep safe while you're traveling. What vaccines do you need? Certain countries need you to get certain vaccines. So that is also an infographic there that talks about what vaccines you may need, where you can get them. And then also there's a little area about the embassies. If you're going out of the country, you might want to make sure that you have the embassy contacts and stay in the loop of if there's any restrictions or anything like that, you'll get information. So I think this is really good information that we are really excited to start sharing after this live.
Mhm. Yeah, I also really appreciated the keep safe while you're traveling. And it's one of those things where, you don't think about it until you start to read the fine print and find out, oh, you need a typhoid vaccine or yellow fever vaccine when you're traveling to different countries. Going on cruises, you may know that you might not think that you need them, but depending on what country you're going to, they might require. Traveling to the African continent, there's a bunch of vaccines. And you can start with talking to your family doctor, your pediatrician for your children, or your own doctor to find out information. They are available also through, I think your doctor can do a referral to an infectious disease specialist who can also provide the testing, the vaccines for you. And if you need like medications, like if you're traveling to some African countries, you need like malaria medication that you take, so you can get that information available there. And so it's pretty interesting, and it just helps you to prepare yourself. And many states, and I think there are a couple in Connecticut, but in a lot of the big states, they do have travel clinics. But those are very expensive. You have to pay out of pocket for them a lot of times. So you should always start with going to your pediatrician or your family doctor, because many times those vaccines are covered by your insurance. So just the more you know, good information to prepare you to stay safe while you're traveling. And yeah,
I was just going to say, on each infographic, there is a link at the very bottom that'll take you right to the CDC page regarding like for the travel tips, where you can find if you're a pediatrician or if your doctor doesn't have those vaccines, where you can get them. So that is like all there. We're trying to make it easy for everybody to access.
So yeah, thank you everyone for tuning in. This very 101 on newborn screening and vaccines, and stay tuned to Pat's Facebook page and our social media pages for more in-depth information on all the stuff that we talked about, and those wonderful infographics that will be able to, that will provide you some resources if you want to do deeper dives on any of these on either newborn screening or on vaccines. So thank you all for listening, and stay tuned. Talk to you later. Bye.